I'm Dr. Shamieh, minimally invasive spine surgeon. Today we're talking about patients that come into my office with neck and arm pain. Typically a patient will come in and they say that they either woke up with a crick in their neck or they did something and felt a pop in their neck. All of a sudden the pain starts in your neck and then travels down a certain arm. That pain will go to certain fingers into the hand. And so by doing a physical examination, we can figure out which disc was herniated or injured in the neck. A perfect example of this is a patient of mine named Julie Tamplane. She came into the office with neck and right arm pain.
I lived in chronic pain, so anything that I did, picking up the groceries, cleaning my house, sneezing, coughing. If you got a cold, I felt like my neck was in severe pain. Just everyday life, I would constantly hurt.
When Julie came to see me in the office, she was having neck and right arm pain. That neck pain went from her neck, traveled down her arm and into the thumb and index finger of her right hand. That's indicative to me of the C6 nerve root being affected. She was also having biceps weakness. So that muscle group is usually correlating to the C6 nerve root. So it made it difficult for her to pinch with her index finger and her thumb. It made it difficult for her to feel with those two fingers, and she had lost some strength in her biceps, which obviously causes problems in everyday life. Taking a look at Julie's MRI of her neck, you can kind of see that this is a cross section of her neck. Her brain is located here, and her spinal cord is located in the middle of the spinal canal. Most of the discs look perfect. There's one area where the disc has squirted out into the spinal canal. What I tell people in clinic is that a disc is like a jelly donut with a hard outer ring and jelly in the middle. The jelly can squirt out of the donut and end up in the spinal canal, which causes problems because of nerve root compression. So if you look at the cross-sectional cuts, on the right side, the nerve that is being affected is the C6 nerve root. The jelly donut has squirted jelly out of the donut and is hitting the nerve root. Some of the ways that we can treat this is through a cervical total disc replacement.
When Dr. Shamieh walked into the room and he explained my MRI and we went over how we could fix me and make me into a better me, I honestly have never felt so comfortable with his bedside manner and everything that I shook his hand and asked him when his next available appointment was.
The procedure that I performed on Julie is something called a total disc replacement. The patient's completely asleep, and we make a very small, less than 1-inch incision in the front of the neck. And of course, I make it as cosmetic as possible. We go and we remove that disc in between the two bones. So we remove all of the donut and all of the jelly. We take the pressure off of the nerve root that's going into her arm, and so it relieves the pain associated with that compression. Once that's done, you have to put something in between there. And so we put something called a total disc replacement, which is 2 plates and a piece of plastic, which will allow the bones to move in a natural fashion, as opposed to something called a cervical fusion, which would allow those bones to fuse together. So the major advantage to a total disc replacement, it allows patients, especially young patients, the opportunity to keep their range of motion and to decrease something called adjacent segment disease, which could possibly cause future surgeries. To hear how she did, let's listen to what she said in her own words.
I feel like I can do anything now. The pain is completely gone. I can write without having a cramp in my hands from not feeling my whole entire arm. It's incredible. After surgery, I have a limitless amount of things that I can do in Pure Barre. I can move my neck in any which way, shape, or form, and I have 0 pain.
We were so pleased to hear of Julie's good results. It truly is my passion to help patients in severe pain with the least invasive procedures with the least amount of recovery. If you have any more questions, please visit our website at gospine.com, GeauxSpine.com. Thank you, and God bless.